This is One on One. Welcome, this is Steve Adubato. We're in Camden, New Jersey. We're thrilled to be speaking with Dr. Annette Reboli, who is the Dean Professor of Medicine, Cooper Medical School of Rowan University here in Camden. Good to see you, Dean.
Hello, good morning.
Now, you are a product, I just want to say, of Newark, New Jersey, my hometown.
Yes, absolutely.
And speaking of cities, the city of Camden, it's got a bright future, doesn't it?
Absolutely.
Because?
Because of everything that's happening here, the eds and meds, the educational institutions and the medical institutions being part of the transformation, all of the new companies that are coming in, the research initiatives, this is going to be the place to be.
Dean, talk about the partnership between Rowan and Rutgers University and the building we see behind us. That is, in fact, the Joint Health Sciences Center. What does it mean? Why does it matter?
Well, it matters on several levels. First of all, it's a collaboration between Rowan University and Rutgers. And collaboration is crucial to success in the current age and on a go-forward basis. Second, it will provide educational programming that will help our school, our students, the community.
How does it help Camden?
How does it help Camden?
Yeah.
Well, it helps Camden economically as an economic engine, but it also helps Camden in providing inspiration and opportunity for young people from Camden. We have students in our school who were born and raised in Camden, including two twin sisters who graduated this past year.
By the way, tell folks where we're taping right now and how it's connected to what you're talking about.
We're in our medical school building overlooking the rest of the city here, including the Joint Health Sciences campus.
That matters to young people and others in Camden when they see this.
Yes, it's absolutely inspirational. We have a number of programs that we developed even before we had medical students here on our campus. They're called pipeline programs. They're programs to encourage young people from this community to pursue careers in science and in medical school as well, to pursue things that they only dreamed were possible.
Dean, what is this? The CHAMPS, or CHAMP program, the Champions for Health Advancement Through Mentoring and Primary Care Partnerships. The CHAMP program, what is it?
So the CHAMP program is a recent grant that we received. It's part of a continuum.
From the federal government?
From the federal government, from HRSA. It's part of a continuum of programs to develop primary care activities and to enhance primary care, which of course is crucial to health of the citizens globally throughout the United States. So the program started with a program a few years back to develop residency programs in primary care.
Right.
The second part was to develop innovative educational programming, which we developed a 3-year track for medical students, and we have that currently operational with students in it. And the third part is to develop practitioners, including physicians' assistants, who are interested in primary care, where they actually do educational programming that enhances their position, leadership skills, how to transform healthcare, and then they do a project in their actual practice that will enhance quality, affordability, and access for the citizens of the community.
You know, Dean, one of the things that really strikes me is that we're going to be interviewing, while we're down here today, one of your medical students, I believe, Lakeisha. She is graduating in May of 19.
Yes.
But one of the things I read about her is that she's been actively involved in the city of Camden in mentoring programs and trying to understand. I think she wants to be OB-GYN. That's the area she's going into. I think to myself, the experiences she has had with the people of Camden, serving the people of Camden, mentoring young people in Camden, it impacts the kind of physician she will be. Am I making too much of that?
Absolutely. No, absolutely. We require all of our students to do what's called service learning. And what they do is they do a variety of programs, most of which they've developed themselves, so it's student-driven and supervised by faculty of the school, teach soccer to young people in Camden, help with the garden, a community garden, tutor young people.
Why does that matter in medical school?
So it matters because it allows the students to actually get out and see the community and learn about social determinants of health.
Yeah, that term gets used a lot, social determinants of health. What does that mean?
So what that means is the other things that all influence your health and how you avail yourself and access health care.
Poverty,
Poverty,
housing,
your
transportation,
housing, everything.
crime, et cetera. Those are social determinants of health?
Yes, all of those things have an impact on health of our communities. And it's crucial. So what the students learn when they go outside of the walls of the classrooms in this building will make them physicians of the future, will make them best able to serve. You know, we're preparing our students not for the practice of medicine that I have.
Right.
We're preparing them for the future practice of medicine, learning and working in teams, cultural competency, understanding barriers, working with diverse populations, people who look different and act different and have different customs than yourself. All of these best prepare the workforce to serve our patients.
And you got me thinking, because this is actually, this interview, the interviews we're doing here serve many purposes. One, we're doing a series on innovation in the state, but also on the future of healthcare in the state and nation. So what we're talking about is actually training, educating the physicians of tomorrow in a way that prepares them for the future, a very different healthcare model, delivery of healthcare, et cetera, et cetera.
Yes.
Are you looking for different kinds of students because of that, or do you take them and you help shape them into the kind of physicians they need to be?
So a little bit of both, but we use our mission in the selection of our students. Last year, we had 7,000 applications for 104 spots.
Really?
So we look beyond just the metrics. Of course, we use the metrics, grades, standardized test scores. But
beyond that, what do you look for?
We look for students who have a deep and abiding commitment to their communities, to work within the community, who have had experiences in urban and rural environments, who have an interest in being patient advocates, advancing health care for their communities. So we look for a different type of student. And then when that student comes in, we work with them to graduate competent, confident, and compassionate young physicians.
But also, I'm a student of leadership. I write about a teacher. In fact, I've taught it at Rowan in the past. You're looking for leaders.
We're looking for leaders, and we're developing leadership skills in them too. So as part of our ambulatory clinic, we have a leadership theme, and the students get formal leadership training. They get Lean Six Sigma training to help them address
That's great stuff.
healthcare problems. In fact, in the room next door, they're doing their Lean Six Sigma training. They're all getting yellow belts.
As we speak?
As we speak, all of our students get yellow belt training. And they tackle real problems in the hospital environment.
Because that's the kind of physician
Those
we're
are
going
the
to need in the
types of
future.
things, and also working in teams with other healthcare providers, not just being the solo practice physician. That day is gone forever.
Dean, we thank you
Thank
for joining
you.
us and educating us and everyone watching right now. We appreciate it.
Thank you.
Now, I'm Steve Adubato. Dean, thank you very much, and we'll catch you right after this.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 30 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by New Jersey Sharing Network, NJM Insurance Group, Choose New Jersey, MD Advantage Insurance Company of New Jersey, the Turrell Fund, supporting Right from the Start NJ, United Airlines, and by Adler Aphasia Center. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.